My name is Mike Morris. I'm the MLA for Prince George Mackenzie, and I'm also the Minister responsible for Public Safety and the Solicitor General for BC. I welcome everybody to this important announcement. It demonstrates the amount of work that's been done behind the scenes and the collaboration amongst a lot of stakeholders and a lot of partners that we have within health in British Columbia here. I want to take a moment to introduce our guest speakers. I have my colleague, Minister Dr. Terry Lake, Dr. Alan Ruddiman, President of the Doctors of BC, Dr. Demont Kelleher, Dean of the UBC Faculty of Medicine, Dr. Granger Avery, the President of the Canadian Medical Association, and Dr. Dave Snedden from Prince George. To begin with, please welcome Health Minister Terry Lake to the podium.
Thank you, Mike. I always like to tell the real docs that veterinarians are doctors too. It's really great to be here in Prince George, and first I'd like to acknowledge with respect the Tene First Nation traditional territory upon which we are gathered today, and also thank all of the partners that are part of this very important announcement. It is the result of a collective effort to strengthen rural healthcare services in the province of British Columbia, and so I'm proud to be here on behalf of Premier Christy Clark and my colleague Mike Morris to make this announcement. There are 600,000 British Columbians living in rural areas of our province, 14% of the population. And yet, rural BC is such an important part of our economic and social success. Economic diversity is a hallmark of BC, but we cannot forget how much of our province depends on the resources and the people that come from and live in rural BC. Rural communities in BC are often small and dispersed, and we know that British Columbians in these communities face challenges in accessing healthcare. Geographic remoteness, long distances, low population densities, reduced availability of certain types of providers, and of course, as we get into this time of year, harsh weather conditions are only a few of these challenges. The practical reality is that rural and remote communities in BC need a customized approach to healthcare service delivery. Today's announcement recognizes both the importance of rural health and the need for customized solutions, which is why I'm pleased to announce the establishment of the Rural Doctors UBC Chair in Rural Health. This position is being funded through a $5 million endowment from the Joint Standing Committee on Rural Issues. That's a partnership between the Ministry of Health and the Doctors of BC. I'm also very pleased to announce that Dr. Dave Snedden, who has been here at UHNBC since 2003, has been appointed the founding chair of Rural Health in British Columbia. Congratulations. As the Rural Doctors UBC Chair in Rural Health, Dr. Snedden will provide academic leadership in rural affairs in BC, enhance the delivery model for rural healthcare delivery of services, and improve the recruitment and retention of rural practitioners. And I want to recognize Dr. Mary Johnson, whom I met at the airport today. I did some inquiries about you, Mary, talked to my friend Shelley in Clearwater, and Shelley told me that you are the champion of growing your own, the importance of really cultivating interest in rural health in people who come from rural British Columbia. And so when we talk about the recruitment and retention of not just physicians, but all healthcare practitioners to rural BC, Mary has done a lot of work. Dave's going to do more work to make sure that we can build resiliency in rural communities. So in addition to the endowment, there will also be operational funding of $350,000 over the next 5 years to support the work of the new chair, to create a Dean's Advisory Committee on Rural and Remote Health within the UBC Faculty of Medicine, and provide scholarship opportunities to further rural healthcare research. As a rural physician himself, Dr. Snedden is well poised to represent the collective voice of rural practitioners, and we look forward to the value this position will bring as we work together on building a patient-centered rural healthcare system. One of the priority areas that we developed early in my term as health minister was to look at rural healthcare and design a system that is responsive to the very challenging needs of rural British Columbia. So the Rural Healthcare Strategy provides a framework for the planning and action needed to establish a consistent approach to addressing health services through a rural lens. And it recognizes that healthcare delivery plans and funding have to recognize and support the needs of rural communities, which is what we've done to arrive here today. It's the first of its kind in British Columbia, and in fact the first of its kind in Canada, and the UBC Chair in Rural Health is just one of the many solutions that we're implementing to address healthcare access challenges in rural communities in BC. Dave and I have already talked about transferring of patients into specialty centres and the challenge that comes with that. So one thing that he will certainly be working on. And some of the other areas we need to explore include improving team-based care, to expand the use and application of telehealth, and create customized solutions for each community, which aligns with the Ministry's strategic priorities and rural strategy. The creation of this position was truly a group effort and a perfect example of the benefits of collaboration in healthcare. And I look at our front row of speakers here, Dr. Granger Avery, President of the Canadian Medical Association, Dr. Alan Ruddiman, President of Doctors of BC, Dr. Dermot McKellar, the Dean of the UBC Faculty of Medicine. All of these folks have been truly engaged with leadership around not just BC but around the country, with a real focus on creating a sustainable, resilient healthcare system for all British Columbians. So I want to thank each and every one of you for the partnership that we've created together. It feels like we're rowing in the same direction in this province, and I think that's truly a model that other provinces are envious of and will continue, I think, to spread across Canada. So thank you. I'm very excited to look forward to Dr. Snadden's work, and great to be with you here in Prince George today. Thank you.